Welcome back, my dear friends. Good evening, all of you. I hope you are all doing good. So let us discuss about today's topic. So today we are going to discuss about the carotid triangle. Before we are going to know about it, please subscribe to my channel. Yes. So the carotid triangle is a triangular space which is present below and behind the hyoid bone. So can you find the triangle space here? This is the intermuscular space which is present below and behind the hyoid bone. Let us see the boundaries of it. So superiorly, antero-superiorly, we can identify the posterior belly of digastric, and antero-inferiorly, we can identify superior belly of omohyoid, and posteriorly, we can identify the anterior border of sternocleidomastoid. So upper half of the anterior border of sternocleidomastoid muscle, which is forming the posterior boundary of the carotid triangle. So between these boundaries, the triangular intermuscular space which is located, and it is consisting of very important structures, very important structures. There are common carotid artery, internal jugular vein, and the group of nerves which are present that we are going to discuss now. So in this picture, we can see the boundaries on the dissected specimen. So the dissected specimen, you can identify the first one is the posterior boundary. It is formed by the anterior border of sternocleidomastoid. This is anterior border of sternocleidomastoid muscle, which is forming the posterior boundary of carotid triangle. And anterior-inferior boundary is formed by superior belly of omohyoid. This superior belly of omohyoid is covered by this fascia, investing layer of deep cervical fascia, so we are not seeing it clearly. In the next image, I am going to show you clearly. Yeah. In the second picture, we can identify the superior belly of omohyoid clearly. So try to observe the superior belly of omohyoid muscle, how the muscle fibers are running. So the superior belly of omohyoid muscle fibers are running obliquely, and then it extends into the posterior triangle, where we can identify the inferior belly of omohyoid. We can identify over there. So this is about the course of superior belly of omohyoid, how it is forming the antero-inferior boundary of the carotid triangle. And superior boundary, we can identify the posterior belly of digastric, superior belly of omohyoid, which is forming the antero-inferior boundary of carotid triangle. Yes, coming to the floor contents. So we have seen the three boundaries: posterior boundary, antero-superior boundary, and antero-inferior boundary. Now we are going to identify what are the floor contents. So floor is formed by three muscles: middle pharyngeal constrictor, thyrohyoid membrane, and inferior pharyngeal constrictor. So these are the three muscles which are forming the floor of the carotid triangle. Now let us going to discuss about the contents of the carotid triangle. One is common carotid artery. Common carotid artery extends into the carotid triangle, and this common carotid artery is going to bifurcate into internal carotid artery and external carotid artery. And external carotid artery, which is present in this carotid triangle, it is giving five branches that I will let you know how to remember the branches names in the carotid triangle in the next slide. So along with this arteries, we can identify the vagus nerve. The branch of the vagus is superior laryngeal branch, which is present in it, and then spinal accessory nerve, there is a 11th cranial nerve, which is present in it, and hypoglossal nerve, there is a 12th cranial nerve, which is also present in this carotid triangle. So along with this artery and the nerves, we can identify the internal jugular vein, and the common facial vein. So it is very easy to remember the contents. First, artery, vein, and nerve. Let us see the branches of external carotid artery in the carotid triangle. So try to see the branches. So lower five branches of the external carotid artery which are present in it. These are the nerves, and the vein is internal jugular vein. So nerves are 10, 11, 12 cranial nerves. 10, 11, 12. 10th one is vagus, 11th one is spinal accessory, and 12th one is hypoglossal nerve. So these three nerves which are present in this carotid triangle. So to remember the branches of external carotid artery, In the carotid triangle, I have a mnemonic. Smile on lover's face, amazing. Smile on lover's face, amazing. If we just take out the first letter from every word, we can find S-O-L-F-A. So S stands for superior thyroid artery, O stands for occipital artery, L stands for lingual artery, F stands for facial artery, and A stands for ascending pharyngeal artery. It is very easy to remember, guys. Now let us see how the five branches are coming from the external carotid artery. Means which branches are coming from anterior aspect of the external carotid artery and which branches are coming from the posterior aspect of external carotid artery. So the three branches which are coming from the anterior aspect of the external carotid artery and the two branches which are coming from the posterior aspect of external carotid artery. So the three branches are arising from anterior, two branches are arising from the posterior aspect of external carotid artery. So the three branches which are coming from anterior, they are superior thyroid artery, then above it lingual, above the lingual facial. Sometimes the lingual, it may have a common trunk along with the superior thyroid artery. Sometimes this lingual artery, it is having a common trunk along with the facial artery. So that's how the three branches, they may have the common trunk, or sometimes they may arise individually. So three branches which are arising from anterior, two branches which are arising from the posterior. So the posterior branches which are arising from the posterior aspect of external carotid artery, one is occipital artery above, then below that ascending pharyngeal artery. Below that is ascending pharyngeal artery. Okay, so that's how we can remember the five branches of external carotid artery which are present in this carotid triangle. Now moving to the nerves. How to remember the nerves which are present in it? So first one is spinal accessory nerve. Spinal accessory nerve under the sternocleidomastoid muscle we can identify spinal accessory. After that we can identify the loop of hypoglossal nerve. Loop of hypoglossal nerve, that is ans cervicalis, which is present in it. Loop of hypoglossal nerve, and also the vagus nerve which is present in this carotid triangle. So this vagus nerve, it is present inside the carotid sheath. Carotid sheath, it is a sheath, it is a thick deep fascia which is covering the external common carotid artery, internal jugular vein, and also the vagus nerve. The three structures are trapped or covered by this fascia. Inside the fascia we can identify the vagus nerve as well. So 10, 11, 12 cranial nerves which are present in this carotid triangle. Now let us discuss about the two important structures. One is carotid sinus, another one is carotid body. What is this carotid sinus? So the carotid sinus, it is a fusiform dilation which is present at the bifurcation of common carotid artery. So we have seen external carotid artery and its branches in the carotid triangle. Now if you just look at from where does it comes, the external carotid artery is a branch of common carotid artery. So the common carotid artery left side, it is directly arising from the arch of aorta, whereas at the right side it is it is arising from the brachiocephalic trunk. So right and left side, the common carotid artery, it is extending upwards and enters into the carotid triangle, and it bifurcates into internal carotid artery posteriorly, external carotid artery anteriorly. So that is about the brief introduction about the common carotid artery and the bifurcation and the branches of it. Now at the origin of the internal carotid artery, where the common carotid artery bifurcates, where the internal carotid artery is arising, from that particular area we can identify the fusiform dilation. That fusiform dilation, it is called as carotid sinus. And now what is the importance of this carotid sinus? Means it is receiving nerve twigs from the vagus nerve, from the glossopharyngeal nerve, and from the sympathetic. Okay, it is receiving nerve twigs from the vagus, that is the 10th cranial nerve, and from the glossopharyngeal, that is from 9th, and also from the sympathetic trunk. So the carotid sinus acts as baroreceptor. It is acting as a baroreceptor for controlling intracranial blood pressure. So the stimulation of this carotid sinus, what happens is it produces a reflex fall of a blood pressure and slowing of the heart rate. Just remember, carotid sinus we have seen, and it is receiving nerve supply from 10th cranial nerve, 9th cranial nerve, and also from the sympathetic. Okay, then stimulation of this carotid sinus, what happens is, it is a baroreceptors are present here. It is acts as a baroreceptor, and stimulation of this carotid sinus causes fall of intracranial blood pressure. So if the intracranial blood pressure increases, so to reduce the intracranial blood pressure, what usually the surgeons do, cardiothoracic surgeons do, they do is they stimulate the carotid sinus. It is one process to decrease the intracranial blood pressure. Okay, now we are moving to think about a look at the carotid body. So now we have seen the carotid sinus. Now let us see what is carotid body, which is present in the carotid triangle. So the carotid body, it is a small oval neurovascular structure situated close to the posterior wall of carotid sinus. Close to the posterior wall of carotid sinus. So carotid sinus, what we have discussed, it is a fusiform dilation at the origin of the internal carotid artery, at the posterior wall of the carotid sinus, where we can identify an oval shaped neurovascular bundle called as carotid body. Carotid body. Now, what is the importance of this carotid body? It is receiving the rich nerve supply from glossopharyngeal again, vagus, and sympathetic. So carotid sinus is receiving, and also the carotid body is also receiving nerve twigs from the vagus, from the glossopharyngeal and from the sympathetic nerves. So the body is enveloped by sheath cells. Let us see how the sheath cells are present. Now, when you take a section of the carotid sinus and the carotid body and observe and stain it and observe under microscope, we can identify the type 1 and type 2 epithelial cells. So the type 1 epithelial cells, they are called as glomus cells, and type 2 epithelial cells, they are called as sustentacular cells. And these two types of cells, and they are permeated by fenestrated capillaries. Can you identify inside the glomus cells? You can identify small blood vessels are also present. They're called as fenestrated capillaries. There are fenestrated capillaries. They are permeated by fenestrated capillaries. And then, what is the importance of it? Importance of the carotid body. It is acting as a chemoreceptor. It is acting as chemoreceptor. What happens if you stimulate this carotid body? Stimulation of the carotid body by anoxia means less oxygen. If less oxygen is present in that, then it is stimulated, and stimulation of the carotid body by anoxia produces reflexly a rise in the blood pressure reflexly a rise in the blood pressure and heart rate, and changes in the depth and rate of respiration. Now, what we have seen in the baroreceptor, when you stimulate that, blood pressure, intracranial blood pressure will fall down. When you stimulate the carotid body, the blood pressure increases. So this is the chemoreceptor. There is the action of chemoreceptor and the function of chemoreceptor. Now let us see how the dissected images, when you just try to see in the dissection, how we can identify. So we have just separated the sternocleidomastoid muscle here, and we can identify the superior belly of Omohyoid. So this is forming the anterior-inferior boundary, and this is the internal jugular vein, and here you can identify the internal jugular, and then this is a common carotid artery, and here this common carotid artery is going to bifurcate into external and internal carotid arteries. So here we can identify the first branch, which is coming from the external carotid artery, which is running downwards. So three branches which are arising from the anterior aspect of the external carotid artery. The first one, which is running down and runs towards the apex of the thyroid gland, that is nothing but superior thyroid artery. Then, so the next one is from the posterior aspect of the external carotid artery, we can identify a small part of an artery called as occipital artery. Occipital artery, which we can identify over here. Then, yeah, here you can identify. Next, the two branches which are coming from the anterior aspect of external carotid artery. One is lingual artery. Then upwards, above the lingual, you can identify the facial artery, which is running upwards, and it is it is close related to the lateral surface of the submandibular gland, and it is sandwiched actually between the submandibular gland and the medial surface of the body of the mandible, and it is forming a loop and then ascends upwards and extends into the face. That we'll see later in the next classes. Then here you can identify the ascending pharyngeal artery, which is coming from the posterior aspect of external carotid artery. Yes, in this picture we can identify. There are two nerves, C2, C3, ventral rami of C2, C3, and here you can identify the loop of hypoglossal nerve, that is called as ansa cervicalis. You just remember. And in the next upcoming classes, we are going to discuss in detail about how the loop of hypoglossal nerve is forming, and how the branches are coming, which branches, and the branches applies to the which muscles, that we are having a separate class on it. In this class, we have just discussed about the boundaries, contents of the carotid triangle. The clinical aspects of it is potato tumor. So the potato tumor of the neck is a rare feature and produced by enlargement of carotid body. The tumor moves transversely, shows transmitted pulsation, and is often associated with slow pulse and attacks of fainting due to the pressure on the carotid sinus. Okay, so try to remember where it is present. The carotid body is present at the posterior wall of the carotid sinus. If the carotid body enlarges, what happens is it forces pressure on it, pressurize the carotid sinus, and causes fall of the blood pressure. So that is about the clinical aspects and the contents of the carotid triangle. So that is about the carotid triangle, and we will have how which structures are forming the roof. Already have seen in the anterior triangles of the neck. One is skin, superficial fascia, that is a platysma subcutaneous muscle, and also the investing layer of deep cervical fascia, which is forming the roof structures of carotid triangle as well. So that is about carotid triangle, boundaries and contents of carotid triangle. So with the next class, with the new class, we'll gather and try to study once again. Just turn your pages, open the book, and try to find out how the carotid triangle is formed. And if you are a student, if you are a medical student or a dental student, try to find out the structures in the dissection so that it will be easy to remember the structures. Thank you, dear students. See you soon with a new class.